Assalamu alaikum. My name is Muhammad Awais and I am one of the assistant professors in pediatric department of the Said Medical College. I hope that you are doing well. Our topic of today is febrile convulsions or febrile seizures. So definition. Febrile seizures are the seizures that occur between the age of 6 months and 60 months with a temperature of 38 degrees centigrade or higher. These seizures are not as the result of central nervous system infection or meningitis or any metabolic imbalance, and that occur in the absence of a history of prior afebrile seizures. What does it mean? That these seizures, which we call febrile seizures, are present at a specific age group, definitely associated with fever, but these are not associated with meningitis and not associated with any metabolic abnormality and not primarily associated with the epilepsy. However, that can lead to epilepsy in later life, which we call complex febrile seizures. We will discuss them later, but not primarily due to epilepsy. Simple febrile seizures. A simple febrile seizure is primary generalized, usually tonic-clonic attack associated with fever, lasting for a maximum of 15 minutes and not recurrent within a 24-hour period. So what does it mean? Usually they are generalized tonic-clonic and associated with fever, but less than 50 minutes of duration, and there would be no second fit within that particular 24 hour. These are simple febrile seizures, but the second form, which is complex febrile seizure, is more prolonged, more than 15 minutes, and they're focal and or recurs within 24-hour period. So multiple seizures may be present within 24-hour period. There is another entity called febrile status epilepticus. Is a febrile seizure lasting for more than 30 minutes despite using the conventional anti-epileptic medication during the seizure. Febrile seizures are most common causes of childhood convulsive disorder and occur in 3 to 4% of children. These are twice as common in boys as girls. So they are more common in boys than girls. More than 90% of febrile convulsions are generalized and they are less than 5-minute duration and occur early in an illness, for example, otitis media, pharyngitis, adenitis, or UTI. A strong family history of febrile convulsions in siblings and parents suggests a genetic predisposition. An autosomal dominant pattern of inheritance may be present. So that is the reason we usually ask the family history of the child presenting to us in the emergency with febrile convulsions. 2 to 4% of febrile seizures lead to epilepsy or recurrent non-febrile seizures, and chances are pretty much higher in case of complex febrile seizures, as I already told uh, in the definition section. Chances are very much low in simple febrile seizures, like around 1%, so it is reassuring for the parents whose child is having simple febrile seizures. But chances are higher in recurrent febrile seizures. You can see 4%, and in case of complex febrile seizures, like 6%. Similarly, the child having neurodevelopmental delay or developmental delay or neurodevelopmental abnormalities would be having a higher risk of subsequent epilepsy, like 33% later in life. Chances of getting epilepsy are also high in focal complex febrile seizures, and there is a family history of epilepsy, 29%, 18% respectively. And if there is a less than 1 hour gap between the fever and the occurrence of the febrile seizure, then the chances would be 11% for subsequent epilepsy. So what are the risk factors for recurrence of febrile seizures? Major risk factor is the age. If the age of the child is less than 1 year, lesser the age, the more chances of getting second, third, or multiple attacks of febrile seizures. If the duration of fever, first attack is less than 24 hours, there are higher chances of getting second and third and multiple seizures. If the fever is like 38, 39, mild fever, and the child is having febrile conversions, the child would be having um, likely more chances of recurrence of febrile seizures later in life. There are some other factors as well, like family history of febrile seizures. The children who have that family history they present with the multiple febrile seizures and up till 5 years of age. And if the family history of epilepsy is there, and if the febrile seizures are complex, and daycare or male gender or lower serum sodium, these are the factors for recurrent febrile seizures. Even if there is no risk factor, still the chances of recurrent febrile seizure is 12%. If there is one risk factor, the chances are 25 to 50%. If there are two risk factors, the chances are 50 to 59%. Or if there are three or more, the chances are 73 to 100% for recurrent febrile convulsions. Definitely, meningitis should be ruled out even in a child who has previous history of febrile seizures. So, following are the indications of CSF examination in a suspected case. If the child is under 18 months of age, definitely we will think of doing CSF examination. We will keep our threshold very low for doing lumbar puncture. If the recovery is very slow, no other cause of fever is found, close follow-up is not possible. Prolonged febrile seizures may cause mesial temporal sclerosis that can cause damage to the brain and may be responsible for later febrile fits or epilepsy. Common causes of fever in the febrile convulsions are mostly viral upper respiratory tract infections, acute otitis media, mastocytitis, pharyngitis, adenoiditis, urinary tract infections. So for diagnosis, definitely a good history, a good clinical examination, and after assessing and ruling out meningitis clinically, we need also investigations like complete blood count, especially for the total leukocyte counts, white cell count, the blood sugar. The blood sugar is low. We need to give a bolus of glucose and dextrose, and if the calcium is high, we need to correct the calcium, phosphorus, urea, and electrolyte imbalance. If electrolyte imbalance is there, we need to correct it as well. Lumbar puncture is done if the diagnosis is in doubt. We have already discussed. And EEG. EEG is electroencephalogram or electroencephalogram is indicated if febrile seizure is complicated. If child presents to you in emergency with fits in a convulsive state, definitely first thing I think should be the oxygen, ABC, and after oxygen, lateral position to avoid any aspiration, and then you will go to put an IV line and you will give some anticonvulsant like diazepam, midazolam, and sometime we need phenobarbital as well. And after controlling the seizures, we need to lower the temperature by giving sometimes intravenous paracetamol or parectal paracetamol along with tepid sponging. If you suspect some bacterial infections, definitely an empirical antibiotic is started intravenously. And family should be reassured in case of simple febrile seizures, especially because these are not the cause for any developmental delay, and these are not the cause of any epilepsy later in life. So less than 1% or almost 1% chances. So Coming to the prophylactic anticonvulsants, these are not indicated in uncomplicated febrile convulsions, however indicated if the febrile seizures are complicated or prolonged. Also indicated if medical reassurance fails to relieve the anxiety of parents. Parents are very much worried, then drugs like diazepam or phenobarbital are used for prophylaxis sometimes. Prognosis is generally good in simple febrile convulsions, but infant with the complex febrile seizures may develop epilepsy later in life, as I already told in first slide. About 6% chance, and there's another slide I've told you the chance as well. And about 50 to 75% of recurrence takes place within 1 year of initial seizure after the first year, and about 90% occur within 2.5 years. Recurrence rate can be influenced by intermittent use of rapid-acting anti-epileptic drugs or continuous prophylactic treatment sometimes. Thank you very much. And if you have any question, you can ask under the comment section on the YouTube channel. Thank you very much.